Good afternoon, everyone, and welcome. Thank you all for joining us today for the Black People Like Me PCORI project hosted by Allergy and Asthma Network. I'm Tanya Winders, the President and CEO of Allergy and Asthma Network, and it's my pleasure to welcome you to the fifth in our series of Black People Like Me virtual conferences. Today, we have an exciting lineup with three very interesting patient stories, and we'll hear from those individuals in a few moments, and I'll introduce them. And then we also will hear from Dr. Laverne Carter and Dr. Leroy Graham. The title and topic for today is My Journey with Asthma, COVID-19, and Other Health Issues, letting researchers know what questions we need answered. So this session is dedicated to your questions, to your concerns. And I want to take a moment and thank PCORI, the Patient-Centered Outcomes Research Institute, for their continued support of this virtual conference series. I also want to recognize and thank the Director of Research at Allergy and Asthma Network, Mary Hart, and our Chief Digital Officer, Linda Mitchell. Without their leadership on the team, this series would not have become so successful, and we would not be hosting the fifth in the series today. So again, a round of applause and thank you for all of their efforts. A few housekeeping notes. We will have all of your lines on mute for the duration of the session, but please be sure that you do keep yourself muted. And also, if you are on video, make sure that there are no distractions in the background or keep your video off throughout the duration. You can add your questions at any time throughout the program. We will have a period dedicated to questions and answers, but you can add that question anytime in the control panel, and we'll get to as many of those as possible. We will be recording today's session, and you can watch this session or previous sessions of the Black People Like Me virtual conference series at our website at allergyasthmanetwork.org. So now let's dive in and meet our panelists today. Again, I am so pleased to introduce to you Dr. Laverne Carter and Dr. Leroy Graham, who will lead us on this journey of sharing their own experiences from community projects, engaging communities, and empowering patients. We will spend the bulk of our time in an interview format with a panel of three patients, Aisha Moore, Edwin Bolden, and Shernette Darrington-Zascoda. And today what we'll cover is that patient panel where each patient will have an opportunity to share their own individual story of living with asthma or surviving COVID-19. They'll also share why they've participated in clinical trials and why they believe patient-centered outcomes research is important to the entire Black community. Secondly, we'll cover things we can do to educate and empower the Black community, as well as questions that you specifically want answered. We've already received several questions in advance of the session today. And again, this is your chance throughout the polls and the Q&A time to participate. So please let your voice be heard, because it's that voice that we will then carry forward to doctors, researchers, and to PCORI to continue to develop better programs. So with that, let's get started. I'd first like to introduce Dr. Laverne Carter. Dr. Carter is the President and Project Director of Research Evaluations and Solutions Incorporated. Dr. Carter comes with a wealth of experience on PCORI projects and research projects, and she will share with us her own personal experiences today. And then secondly, Dr. Leroy Graham. Dr. Graham is the founder of Not One More Life, which is a nonprofit organization that now is under Allergy and Asthma Network, dedicated to advancing the awareness and education of asthma, COPD, and other respiratory diseases. Dr. Graham is a pediatric pulmonologist who practiced in Atlanta, Georgia, and has recently retired to the Florida Panhandle. So he is the medical director of the Not One More Life program and of the Black People Like Me PCORI project at Allergy and Asthma Network. So welcome to Dr. Carter and Dr. Graham. Thank you all for being here. And then our most important guest of today, our patient panel. First, we'll hear from Aisha Moore, and then from Edwin Bolden, and then Shernette Darrington Zascoda. And again, these patients have been brave enough and courageous enough to share their own individual journeys of living with asthma, as well as their families' struggle with asthma, the impact on their lives. So let's get started with our first polling question before I hand it over to Dr. Carter. First question is, when receiving care, do you feel informed enough to make your decisions as a patient? So I'm going to go ahead and launch that poll and ask you all to log in your response. We do have well over 600 people on the line today. I think we've got close to 1,000 registered. So it'll take just a moment for everyone to log in your response. When receiving care, do you feel informed enough to make decisions as a patient? Yes or no? I would have probably preferred a sometimes to this one. Sometimes I do, sometimes I don't. Sometimes I sit on the fence, but most of the time I would say yes. So we'll give it just another moment before we share the responses. It's like about 2/3 to 3/4 that have logged in. So I'm going to go ahead and share the results now. Looks like that this is a very empowered group. We see here that 84% say that yes, they do feel informed to make decisions as a patient, but still a significant number at 16% saying that they don't. And so I appreciate your honesty, right? Because this is how we, again, continue to learn, and it's for how to better meet the needs of patients. So thank you for sharing that. All right. So now let's go to our second polling question. And that question is, I feel empowered. Oops. See, you have to go to the second one. I feel empowered and important when I am working with outside organizations and researchers. Always, never, sometimes, or I don't really work with outside organizations and researchers. So again, we'll take a moment, ask you all to log in your response. I feel empowered and important when I am working with outside organizations and researchers. Give it just another few seconds. I love to see those responses coming in at such a fast rate. Technology is amazing that we can be connected from all across the country and share our own experiences. Okay, so I'll share the results here, and what you'll see that is about half say yes. I always feel empowered and important when working with those outside organizations and researchers. 2% say no, 41% sometimes, and 8% are really not engaging consistently with outside organizations and researchers. So thank you again for that feedback. Extremely helpful as we continue to develop the programming. All right. So one more polling question here before we go to Dr. Carter, I believe. And this one is, who has the greatest knowledge in the engagement process? Is it government officials and researchers? Is it doctors and nurses? Is it the community, you as patients and the community as a whole? Or I don't know. Who has the greatest knowledge in the engagement process? So again, please take a moment, log in your reply, and we'll share that with the group. Fantastic. Really appreciate the way everybody is engaging. This makes these webinars so much more interactive and informative, and we really do appreciate your feedback. Okay, looks like we've got over 80%, so I'll go ahead and share the results. And it looks like 23% say government officials and researchers, 43% doctors and nurses, 30% the community, you, and 5%, I don't know. This is really interesting, right?
It is.
Because I always say you're the expert on you and your own condition. I hope that you feel that way. I know I feel that way most of the time. I know my body, I know myself, I know my community and environment, but I don't always have all the necessary information. And that's why we rely on our doctors and nurses and on researchers. And we'll learn more about that in our time together today. All right, so now I'm going to have the privilege of turning it over to Dr. Laverne Morrow Carter, and she is going to share with us a bit more about her role as the President and Chief Product Officer for Research, Education, and Social Solutions Incorporated. Dr. Carter?
Yes. Good afternoon, everyone. All 750 plus and counting. Let's give ourselves a round of applause. So awesome. I'm so excited. This is a journey for me. It's a 40-year journey of being involved and engaging with communities of color. I want to thank Tanya, Mary, and Dr. Graham for the privilege, the honor, and the blessing to be involved. I've been on this journey 40 years, and I can think back, 40 years ago in Newark, New Jersey, when we were engaging face to face, and we did not have this technology. So I feel really blessed to see something this powerful. Linda, thank you for your awesome work with the audience response digitally. This is state of the art, but what I'm most excited about is the 760 people. You all can see. What I'll quickly say is that I am founder and president of RECE. We've been involved with designing, evaluating, and disseminating programs all over the United States for the past 36 to 40 years. We've done a lot of work, and we're considered leaders in prevention science and digital tools. I led the completion of a 2-year PCORI Capacity Engagement Award. PCORI, I love, they're a great funder, they're a great partner, and I can tell you from experience, patients are first. If it's unfortunate people may have missed the face-to-face meetings on site, because that's where you really see the power of patients. Next slide, please. I have 5 rules for engagement, and they may go counter where folks are, but when you're my age with my experience, you can just be authentic and say what you want to say. When I go into a community, first thing I realize is that the community knows more than I do. One of my greatest lessons was in St. Louis, Missouri, when we engaged a group of patients for BJC Healthcare, and it was more men than women, all African American, and they told us that healthcare is a luxury and my doctor won't touch me. Those things after 20 years still resonate with me. And we did articles, we did a publication on that. We actually did an article called My Doctor Won't Touch Me. Someone is saying they can't hear the speaker. Can you all hear me now?
Yes, we can hear you.
Okay. To the last question we had, you as the patient and you as community members on the front line, you know more than we do. You know the problems and the solutions. This is not about education. This is not about being trained. You're living the experience. When I enter to encourage, to facilitate, and empower. It's a passion for me. It's a ministry for me. One thing that I do, and I know a lot of people don't do this, one of the things researchers have been accused of is coming when the money comes and leaving when the money leaves. I always use my projects to bring some economic relief to the persons and organizations I'm engaging. We also look at how we can create jobs for the consumers, the people that are being engaged. And I stay connected with the community even after the dollars are gone. And as a for-profit entity, we use a lot of our profits to continue to engage with communities. So those have been my 5 rules of engagement over the past 40 years. Thank you, Tanya.
Great. Thank you, Dr. Carter. I'm going to back up for just a moment and ask Dr. Graham to weigh in. I think we may have accidentally skipped over a slide. So, Dr. Graham, welcome. We did not mean to do that. Please share with us a little bit more about your background and yourself and the work that you're doing to gain trust in the Black community.
Well, thank you, Tanya. I'm a pediatric pulmonologist, and my career started in the Army. And after getting out of the Army, I went into private practice in Atlanta. And as a pediatric pulmonologist, one of the biggest chronic diseases I dealt with was asthma. And I learned at a very early stage from a patient when I was kind of full of all the knowledge I thought I had, and thought I was a fabulous communicator. The patient told me that I wasn't, and it was a Black patient, that I wasn't really connecting with them. They weren't feeling. Okay, and this was back when I was in the Army, actually. And I took that to heart. And I thought, no matter what kind of a physician you are, if you can't communicate, if you can't develop trust in your patient, if you don't listen to get those things done, you don't help anybody. And I think too many of myself at one time and too many of my fellow physicians have forgotten this. So when I got to Atlanta, I was struck, and I'd already known this from being in private practice, I was struck that asthma was the single most common admitting diagnosis to Children's Healthcare of Atlanta, which is true of every hospital in the United States. And that many of those patients got very, very sick, got in the ICU, and very infrequently, but tragically, as Kellen's father will tell us, they sometimes died. And I also became apparent that what I had read in articles was so very true, that asthma was associated with disparate or increased morbidity, sickness, and mortality among African Americans. And I was also struck by the fact that not many people were doing a whole lot about it. And I got this great idea about having a plan. I was going to change things and so forth. And I had a friend of mine kind of tell me that, being Black doesn't necessarily make it, and that I needed a good partner. And from my own upbringing and from the input of people like my good friend, Reverend Stinson, who's on this call, the most trusted messenger in the Black community, without a doubt, is our Black clergy. So after losing a patient like Kellen Bolden, I went to the head of the Concerned Black Clergy of Atlanta and pitched an idea that we could come out to churches on their time, usually a Saturday, and we would do screening for asthma, we do lung function testing, we do education for asthma. And I found immediately a number of things. People asked questions, even though they'd had a lifelong battle with asthma, that should have been answered or should have been asked far before. And I'd ask them why, and they'd say things like, well, people didn't listen to me, that person didn't seem to care about me, they didn't understand what my life and reality were about. So I realized that it wasn't that I was just that good a communicator, it was the fact that I had chosen the right partner to be a messenger, and that is the Black community. So if you look at our country, which still suffers from racism and still suffers from disparities, the Black church has always been there for the Black community. When people lost their jobs, when people couldn't find food or something, they could knock on the church door. And those churches are led by highly educated, highly dedicated, and anointed leaders, like my friend, Reverend Stinson. And what that did is, by partnering with them, I got entree, not just to be there, but I got the endorsement or the empowerment by people that they trusted, which had very little to do with the color of my skin, but the association I took. And I started to learn a whole lot more about asthma, about people who felt no one had really explained asthma to them. No one understood why it was so difficult for them to do some of the things around the house to rid their house of whatever triggers and so forth. And they were having a hard time just putting food on the table and getting the children to school and children clothed. I learned also that many times their questions weren't answered. Okay, and I'm not talking about racism, I'm just talking about insensitivity. And I learned a lot from the patients. You know, doctor, you want me to do this, this, and this, and this. I've got an extended family in my house. I've got these competing things. You want me to do all these things. I got to get to work. I got to get back. I got to get food on the table. You need to help me do this. So I learned a lot, even as an African-American, that I thought I knew. And I also learned the power of a partnership with a trusted minister like the Black community. And where I've come kind of on this journey now, and as I retired, I left private practice. I ran a charitable clinic for a while. And my board, when I was doing it, decided they didn't want Not One More Life to die. So they found Tanya and the network, and that's how we got together. But now this is kind of what I do, is work with communities. And one of the things that I've learned to do, probably more than any time in my career, is to actually listen to the community. And this Black face doesn't give me a free pass. We as doctors sometimes we're well-intentioned, but we have this knowledge that we feel that we have communicated, and often we haven't. We also sometimes don't appreciate the stresses that families live under, regardless of economic status, but particularly in minorities and the poor. And what I've learned through Not One More Life, and I think, you know, I've shared with people around the country, and this program is an example of that, is what we do with asthma has to be informed by the people we take care of. We have to certainly educate them, but we have to meet them where they are. And one of the things that I've come out of this is that I've tried to teach it as an empowerment. And I used to tell my patients, you know, no one should know as much about your asthma as you do. And I said, and if you're interacting with a physician, or you're interacting with a nurse or anyone, and they're not respecting that, they're not getting that and not informing you, then you need to get another doctor. And I knew that was effective because shortly after I did a few programs in Atlanta, I got a call from some colleagues. And Leroy, I think your Not One More Life program is really great, but my patient came with a case of the butt and was kind of rude. And I'd kind of go through it and I'd find out what it was. And it was obvious to them, even as they discussed it, that those questions weren't being answered, that the transfer of information and trust that is necessary wasn't working both ways. And people have competing, not just minorities, but people have competing things. And we as doctors are so good at giving advice, but not thinking about the context in which that advice has to be managed. So what I would say is that I gained trust from the Black community by having a good message. How do we get people like me engaged in patient-centered outcomes research or clinical trials? Because I think what we've done is we've shown them that we can only get better at treating asthma if what we do is informed by the people we treat. And I also got people to believe that they're not just passive lumps of clay. You know, there's certain treatments that work, there's certain treatments that don't. Some of them differ along racial groups. Sometimes you can't get it even though the doctor prescribes it, and because of pride, nobody lets them know. And then the doctor gets mad at them when they come into the office, they haven't got the medicine that they couldn't afford, or the doctor didn't use the special plan that would have made it affordable to them. So for me, I think the way we get Black people like me engaged in patient-centered outcome research is shifting the emphasis to them. They have asthma. Okay, we need to help them manage their asthma. There is no magic in being a doctor. There's no magic in that. A disease like asthma has so many different aspects that managing the environment, being empowered with an action plan lets you know, hey, I'm starting to get in trouble, but I know what to do. Okay, and listening to people about the triggers. Well, doc, or even the medicine, that medicine doesn't work. And we've actually found that some asthma medicines don't work as well in Black people as they do in white people. So this is why now, coming full circle, it is so very, very important that we have Black people engaged, that we have people now that are informing us, what are the shortfalls? What aren't you learning in our discussions? Because I'm gonna tell you, you know, I thought I was a real good communicating physician, but my assessment of my communication was always 100. But you know, it always wasn't 100 because we often don't listen and we often don't empower people to speak into us, okay? And when I kind of figured that out, aside from Not One More Life, I like to think I became a better doctor. So for me, the questions I want answered, okay, is I want to keep getting fed that. I want my colleagues coming behind me who are working with me to still feel that they can have a community that's going to inform them on what's best for them, how they need to understand their disease, how their therapy works for them, and just showing that it's a partnership. Chronic diseases, I have some health issues at 67 myself. The success of managing illnesses or chronic conditions is a partnership. This top down, I'm the doctor, listen to what I say, that stuff doesn't work. I mean, it doesn't work. It doesn't work when doctors approach me like that at 67. So I think that's the questions that I want to answer, but that's the question I want my colleagues to constantly be engaged in, okay? You know, what works with a patient, what works with a race of patient, what works with a strata of patient, a category of patients, all these things. And quite frankly, we as doctors, sometimes we're not the best listeners, but I know that's changing. And I know that it's changing through programs like this because the information we have is now filtering back. So I'm seeing the slides fly. That means I'm probably over my time, but that's what this means to me. And that's why the partnership with the network, the partnership with Laverne is so empowering for me as a physician at this stage in my career. But more importantly, it's empowering to the people of color that participate with us. Thank you.
Thank you, Dr. Graham. That was fantastic. And again, we share that passion, and that is why you and I get along so well, for sure. So now we're going to turn the tide and really hear from, again, the people who matter most in this conversation, and that is our patients. And so Dr. Laverne and Dr. Graham are going to interview our patients to learn more about their individual experience of living with asthma, some of the struggles that they've encountered, why they've participated as patient advisors for the Black People Like Me program, but also their own individual experience with research, whether that be as an advisor, a focus group participant, or clinical trials, and then the questions that they want answered. So we're very excited to begin that process. And Dr. Graham, I'm going to turn it over to you, and I think we're going to hear from Aisha Moore first.
Well, good afternoon, Aisha. Thank you first and foremost for participating. Tell us a little about your story and how asthma has affected you, and the questions that you either wanted answered or you still need to be answered.
Perfect. Thank you, Dr. Graham, and thank you to the Allergy and Asthma Network for having me. I think I'm going to be able to relate to quite a few on the call, hopefully at least, and just kind of provide a little bit of my experience with asthma. I'd like to say, a lifelong asthmatic. I've had asthma or been diagnosed with asthma as long as I can remember. To sum up my experience with asthma up until my adult life, I would say that my asthma equaled avoidance and albuterol. That's all I ever knew from my childhood up until my adult life. It was avoiding the things that caused that. I lived in a household full of smokers, unfortunately. So we also lived in an underprivileged area where we didn't have some of these resources. And me as a child, I didn't know that a lot of these resources exist or that there were different types of treatments that were available. Growing up around other Black people, of course, we all seemed to have asthma. Everyone seemed to have that label put on them. So it wasn't anything different. It wasn't out of the ordinary for all of us to have asthma or share inhalers or share albuterol, I should say. When you run out of an inhaler, it was nights of running to the drugstore to hopefully get some Primatene Mist that, of course, never worked. But not really getting down to the root cause of what's actually caused or what's actually going on with your asthma. Fast forward, I would say, to my adult life, it wasn't until I started to, I'm actually a respiratory therapist by trade. So this is my 20th year of being a respiratory therapist. But it wasn't until then where I started to gain control over what's going on with my asthma. I never even knew that, allergies could be a cause of asthma. And at that point, when I started to see some of these doctors and talk about, with my allergist, what could be going on, I found out I was an allergic asthmatic. And a lot of that is tied to pediatric asthma. So those are triggers that come along in pediatrics, where if you're not identifying some of these triggers, you just don't know that there's these causes. I have a high allergy with grass. We never rolled around in the grass. We weren't allowed to. We get in trouble because you knew that was going to cause some type of asthmatic attack, I would say. So when I went through my training to be a respiratory therapist is when a lot of the light was shed on different options, different treatments. Living with asthma, you kind of live at a certain baseline and then you don't know what it's like to feel better. So you forget that. And I use that a lot when I do a lot of my asthma education today, is that you forget what it's like to feel better. So when all of this knowledge was given to me and all of the different options and the things we should have been doing, even from a young age, asthma action plans, spacers, making sure you're taking your medications right, none of that was given to us. We didn't have those resources. We were only doing what the doctor told us to do, and it was avoidance and albuterol. And of course, I couldn't change the household full of smokers. Didn't know that that was a trigger, but I mean, that's just kind of a basic wrap up of my, until it wasn't until I got to my adult life that I figured out I had GERD. GERD is also another trigger of asthma. I had allergies on top of asthma. And then I didn't know if it was mild, moderate, severe. I knew none of that stuff. So once I was able to gain this knowledge and to, to be able to return that and work with certain programs and do education and treatments. I mean, I've spent the majority of my career in pediatrics myself. So just shedding this knowledge and the look on these families' faces and, getting them the resources and the medications and the things that they need, or things that they were never told is just, it's mind-boggling to me that, we're not able to reach these communities. So that's what I've been trying to do is, nothing changes unless nothing changes. And to sit on this information, I just feel like this was my calling to get out here and educate. And, I get a unique perspective as being a patient with asthma and also treating asthmatics from adults, pediatrics to adults, and seeing both sides. So I'm able to provide a different perspective, as you'll hear with some of the other panelists on today. That's basically my background story with asthma.
Aisha, that's great. Let me ask you a question right off the bat. You obviously have learned about your asthma. You're a professional taking care of patients' asthma. If you could go back in time, what would you say, or how would you approach those people that took care of you before? I mean, if you were to, because there's people out here listening, they're going through exactly what you're going through. So from where you are now, what advice would you give to them about engaging and getting the information and getting the focus? What would you do? What would you have them do?
Not be afraid to ask the questions. If you're being told one thing and you're given a treatment and it's not working, take control of, I think you mentioned it earlier perfectly, Dr. Graham, is being able to take control of your asthma. You know what's going on with you, and you know when things aren't right. And if you feel like things aren't right, you need to speak up about it and not just settle for what they're telling you. You know things are not right. Speak up about it. Ask for additional resources. There are resources out there. I think we would have dug a little deeper had I known better. But if the albuterol fixed it all, supposedly, then that's basically our baseline that we lived at, not knowing that you shouldn't even be needing your rescue inhaler. So why am I having to take this every day? I think I would have asked more questions about why I'm having to take albuterol or rescue inhaler every day, and why is it not going away? You hear the stories of, oh, maybe it'll grow out of it. But asking the questions, digging a little deeper, not stopping at what you've just been told. I think that's probably one thing I would do differently.
So now as a professional, you probably don't have that same mystique about the doctors you work with. So what are the tips for someone that maybe is in that position, has just heard from you what to say? How do they engage that? I mean, what's the secret sauce to that? Because a lot of people feel that way, feel as you do. They still have that gulf, deserved, I don't think it's deserved or undeserved, with their physician and providers. But you've seen the doctors you work with, you've interacted. Are there any tools that you get to either motivate themselves to ask the questions or have those questions asked effectively? What would you advise patients?
I would advise patients to do a little research, get in there, do the research, do a little digging. If you don't know what's going on, kind of research and see, and then present your findings to your doctor. And if you feel like you're not connecting with your provider, like as you mentioned, Dr. Graham, is look for someone else, word of mouth, but definitely getting in there and doing the research. You can be told anything. And it's another thing where I feel like the conversation kind of shifts as a healthcare provider, even just doing a little bit of the research, it'll shift when they understand you kind of speak their language and that that this is not right. I think I've noticed in my own personal care that dynamic shifts. And then it's a different conversation that you're having going forward. Well, you're asking about this now, I need to talk to you about this. So sometimes that will actually shift. I mean, I know we go to our providers because they're the subject matter experts, they're the professionals, and you want to trust them. And you're trying to build that relationship, but they should also know that you're still feeling some kind of way about it. You've done the research, and they should be okay having these conversations with you. But that would be probably my number one tip is just getting in there, doing the research, and keep pushing and find that connection for that provider that will listen as well.
That's awesome. That's awesome. Well, is there anything else? You've answered my questions perfectly. Is there anything else that you'd like to to leave the audience with as a parting notion of what is it? You've obviously expressed yourself very well. You've got that duality of basically being now a professional, but also as a patient. So if there's like a walk away, you've kind of said it, but if you could put together 2 sentences that you'd like people to leave with and said, this is what Aisha, she hooked me up. This is what she told me. What would that be?
Take control of your own healthcare. As you mentioned in the beginning, just be involved. I think for me as a professional too, this is my duty. I mean, I'm one person, but I feel like this is what I was put here for, is to put that word out. So me personally, I'm going to be spreading the knowledge and trying to get, make sure that not one more life has to experience the things that I experienced growing up and dealing with my asthma and living a better, more fruitful lifestyle. But I think that, if you can take control and grab a hold of your own healthcare and be your expert in your own care, I think that that's just going to get you, it's going to make mountains move for you, and tapping into your available resources and finding out what those resources are.
Well, Aisha, I'd like to thank you. You nailed it. There's nothing I can add to that. I just want to thank you for being here and being part of it. I'm going to turn it back over to Tanya.
Thank you.
Actually, Dr. Graham, we're going to move on now to Edwin and hear directly from Edwin on his story. Edwin, are you on the line? Is your line opened up? Okay, let's move on to Sharnette and then we'll come back to Edwin. It looks like he may have dropped off from the panelist list. So we'll go to Sharnette and then return to Edwin. Sharnette?
Hi.
Hi, great to see you. Thank you so much for being here today. Dr. Graham, why don't you have Sharnette share a little bit about her asthma story?
Okay, Sharnette, first and foremost, thank you for being part of this. Everybody does have a story about asthma. That's an important point. Asthma is not the same in everyone, how they came to it, how it's affected them. Why don't you share a little bit of your perspective on asthma?
Well, I'd like to tell everyone thank you for having me, the Allergy and Asthma Network. I truly appreciate this, and also being a part of the PCORI panel. And it's good to see you, Dr. Graham, and also Dr. Carter. For me, my story is a little different than Ms. Aisha's. I'm an adult asthmatic. I started experiencing some symptoms after I had had a surgery in 2014. And the doctor was like, you need to, and this was my family practice doctor, he said, you need to go ahead and get a PFT done. And also my trade in my respiratory therapist. And I'm like, I think I just got bronchitis or something. And he was like, no, you've been here like 3 times and you need PFT, you have asthma. Well, yep, turned out I had asthma. Well, my asthma decided to go really bad, really fast. By 2016, I'm hospitalized and my asthma caused me to go into congestive heart failure. So it was like, wow, I never would have thought that my asthma would have caused all this grief. So I'm a mom. I have 2 kids. And all of a sudden, I realized my lifestyle is changing. I'm not able to be involved in their activities at school. I'm not even able to hardly go outside. I'm starting to having to bubble up. That's what I call it, when I can't do anything but take breathing treatments. So my asthma got progressively worse, and I'm ending up having to take more and more time off of work even. So I get a good pulmonologist. He runs all the cool tests to find out that I'm going to need surgery. And so I ended up having to get a bronchial thermoplasty. Well, that's how I ended up meeting up with the Allergy and Asthma Network. I got my first surgery in 2017. And then my insurance changed in 2018. I was supposed to have gotten my surgery that January, my second one, because it's a 3-part surgery. And I wasn't able to get it. They denied me my surgery because they said it was cosmetic surgery. So this is the first time I've ever experienced what they call step-down therapy. So it pumped me up with so much steroids for months before I can finally get my surgery. And that's when I reached out to the Allergy and Asthma Network to get some advocacies going for me so I could get my surgery. I finally get my second surgery that October. but by then I was really sick. And my doctor rushed to get my neck surgery because he didn't want anything to happen with my insurance. So I get my final surgery that November due to the fact that they pumped me up with so much steroids all those months and make my bones brittle, my foot broke. And so then I ended up having to get foot surgery in 2019. And it took 8 months for my foot to heal. So asthma has been devastating for me. It's also caused me to even lose my job because they felt like I couldn't do my job because I'm constantly having to take breathing treatments. Once I got my surgery, though, now I'm so much better. I'm able to work. Don't work as many days, though, work maybe 2 days or so. And my life is improved. I can enjoy going outside. I enjoy being a parent again. I was actually kind of scared with my kids because sometimes I even have a breathing attack while driving and having to pull over on the side of the road doing, an inhaler. So that's kind of my story in a nutshell.
Well, that's an awesome story. I tell you, you mentioned thermoplasty, which is a really cutting edge therapy. You want to share from a patient's perspective, what that involves? Because I think a lot of people probably never heard of that. And we doctors get tangled up with technical stuff. And I think as a patient, you could explain that better.
I'm going to put it this is the simplest, coolest terms. Okay,
Cool.
Basically, they go in with a rod, like as far as like a bronchial and a bronch, and it's hot, and they burn out all that excessive tissue that you built up from your asthma because your asthma was squeezing and squeezing and squeezing, and so it builds up all this excessive tissue, and so they burn it out, and then boom, like you can breathe again because like the air is able to flow through the bronchioles.
That's an example why this program's good. I have actually heard one of the inventors of thermoplasty explain that, thinking he was communicating with the patient. She just nailed it much better than he had. And that again is the secret sauce of what we're doing. So this means that to get that therapy, you had very severe and life-threatening asthma, as you described. Can you share what that meant to you? I think you did a little bit, but can you go back and say, how you recognize that your asthma was that severe, what it meant to you, why it made you be obviously a self-advocate in getting adequate therapy? Why don't you share that with the audience?
Well, I knew by my lifestyle changing so drastically. Like I used to exercise like every morning, these 5 days a week. All of a sudden, I was having to do a breathing treatment just to get out of bed. Then I would notice I was starting to tighten up about maybe 4 hours later. And so then I was basically on treatments like every 4 hours. I couldn't even take an inhaler at that point in time because I didn't have enough inhalation. So everything was by nebulizer, which takes more time because on average, that little nebulizer machine takes about 15, 20 minutes. And I was also on not just like albuterol or Xopenex, I'm all having to do Pulmicort at the same time. So that takes up even more time. And then after you do Pulmicort, for me, it's like a taste in my mouth. And so food tastes weird. And so I don't want to eat. And then when I can't eat, I'm starving. And so I overeat. And so that was another thing because of the asthma. For me, I also developed this horrible disease called Cushing's disease. It's a side effect of people with asthma can develop. And with that, a whole bunch of other diseases can come with it, such as diabetes and brittle bones. And I have those things. So that completely, just the breathing of treatment affects my day. So, and having to do so many of them.
So you mentioned 2 major complications of therapy, and I know you know the answers, but I want you to say, why were you at risk for those kind of things with the bone issues and so forth? What was about your therapy that caused that? And I know you know the answer, but I want you to say.
It was, I call it the necessary evil called steroids. And I got a lot of IV steroids. Also, I got a lot of pill form steroids. And basically, if I would have been able to get my surgery early, I wouldn't have had to be on so many steroids for so many months and have so many hospitalizations to go along with it.
So word, that should let everybody know that if you're being treated by a doctor and you're having not only intense therapy, but side effects of the therapy, you got to speak up, you got to speak up. Well, that's awesome what you did. Any closing thoughts on your experience that you'd want to share? You got, let's see, you got 911 people on here. You want to leave them with a parting message based on your experience. What would you do? What would you say?
I would totally agree with Aisha as far as being your own advocate. Because if I wouldn't have gone online on Facebook and found Tanya, I don't know if I'd still be here today, to be honest with you, because I was so very, very sick by then. And also, like I said, I'm an adult asthmatic. So we're treated different than pediatric patients. Sometimes my daughter is also, I'm a generational asthmatic. My father was an asthmatic, my grandpa was asthmatic, my daughter was an asthmatic. I noticed with my daughter, her treatment is far different than mine. People seem to be willing to give you more knowledge and things of the sort, or saying, oh, okay, well, singular is not working, let's try something else. But with adults, sometimes they want to just stick to a plan. And for me, Duonep, since I have heart issues, doesn't work so well since it has albuterol in it. I need Openex. And then go ahead and give me the separate Atrovent if that's what you want to do, but don't give me Duonep. And if I'm half awake in bed and someone comes in there and puts it in the net, throws it on my face, I don't even know what you gave me. I need the people to express to me, what drugs are you giving to me at this time?
Excellent points. And everyone hearing that should understand that there is never a situation that you should not speak into your own care. And think about this. If you have a condition, if you're not doing well, you stand to benefit more than anyone else. And I think this Charmette is such a self-actualized individual. I know she had no problem, but I hope that those listening to it understand that you're not a lump of clay. If people are giving you medications, you're not doing well, you have the right, if not the obligation to yourself, to speak up. Because we don't know everything, and everybody, as she so eloquently put, reacts to these medications differently. So I can't thank you enough, Charmette. You nailed it just like the person before you. I'm gonna turn it back over to Tanya again.
Actually, Dr. Graham, I'm going to flip it back to you, and we're going to hear from Edwin. I think we've got him on the panelist now. Edwin?
I got to tell you a little secret. The only person I fear more than Tanya is my wife and God. She runs a good ship. So she's probably crying now. She knows it, and that's why I keep deferring, make sure I stay on task. But anyway, let's move on to Edwin. And I'm just going to preference this. I took care of Edwin's son, and Edwin's son's no longer with us. So that's the introduction. Also, Edwin struggles with it himself. I'm just going to let you talk. I got no questions. You know what you need to tell these people. Go ahead.
Good evening, everyone. I'm hoping I'm being heard, and I want to apologize for the early snafu. But my name is Edwin Bolden. I'm an asthmatic. I am 58 years of age, and I still struggle with it. I'm doing my albuterol, I'm doing the Advair, and it seems to change when the weather changes. But I'm happy to say that I'm pretty much in control of this now. And right now, I just want to talk about my struggles with my son. My son's name was Kellen Edwin Bolden. I lost him to an asthma attack at age 11 years old in 2001. The exhaust fumes from a school bus triggered his asthma. And he didn't have his meds on him at the time to even get involved with that. He was pronounced dead en route to the hospital. On that same note, Kelly was diagnosed with asthma at the age of 4 months old. So me and his mom went through from the age of 4 months to the age of 11 years. Numerous doctor visits, numerous stays in the hospital from age 4 to 11. All out to the National Jewish Center, we went out there. All kinds of specialists we have seen. But I want to take this moment out to just to say thank you, Dr. Graham. because it was his care and his keen and his knowledge that we got from him to help us with Kellen. Kellen was full of spirits. He would not let nothing get him down. And everybody know being an asthmatic, there's just certain things you can't do. And to tell Kellen he couldn't be a football player, that wasn't his vocabulary. My son played football against all odds. He tried to have a normal life. You know, and what I mean by that, you got to stop and take your inhaler, take a breathing treatment. You might be in the middle playing with young guys and you got to stop to do something. But he was very disciplined with it. And I thank God for that. Kellen really fought all the odds. And for that, I'm thankful. But one good thing that come out of this is that the state of Georgia passed a bill after his passing. If I'm not mistaken, it's State Law 142, Bill 142, the Kellen Edwin Bolden Act, where it gives kids the opportunity to have their inhalers and their medicine in the classroom and not have to be interrupted or have an asthma attack and have to go to the nurse station. The bill was passed where kids in the state of Georgia can have their inhalers in the classroom. So good came out of that. That there's other kids around here that suffer, and that I'm happy to know that my son made a difference. Did it come with a cost? I'm not going to say that. But I just know he made a difference because now I know kids are in the classroom able to take their inhalers if they are suffering an asthma attack. And my last but third thing is this low-income community, we need to cater to them. We need to educate them. We need to fine-tune them. We need to let them understand what this is all about. It's a disease. But with education, we can control it. And me and Kellen's mom, we did our best, and Dr. Graham, and a host of other respiratory agents. It's incredible. I can't say enough about Scottish Rite Children's Hospital of Atlanta. That was home for us from the age of 4 months to 11 years. That was actually home. And the fact that we got a bill passed in his name to help some other child out with asthma, I'm grateful. I'm getting a little choked up. I don't have the right words I want to say, but I do know we need to educate. I have a friend of mine that's on the phone that I spoke to Dr. Graham about it. Her son, I think he's 2 years old. She found out he was diagnosed with asthma and almost lost him. This was in Baltimore, Maryland. She almost lost him. And I think she's on here listening today because I told her she needs to listen, to get educated. And she almost lost him, but I talk to her all the time. I try to give her all kind of advice, much as I can give her. I'm not a doctor, but I can only tell her about past experience. And for that, I'm grateful that I can be able to give to someone else. Asthma, it's a hard thing. But the more we educate about it, the more we know about it, how to control it, what we can do to the community to get people past this, we'll be okay. And on that note, I'm going to turn it back over to Dr. Graham.
Edwin, that's an impossible act for me to follow. And I got to tell you, as a physician, I've lost patients. The loss that I've taken to heart and still with me is Kellen. And, oftentimes when things don't go well, we doctors point to different reasons outside of our care for that. And I got to tell you, Kellen's mom, Kellen's dad, Kellen's neighborhood, Kellen's church did everything they could. We don't know the ways of the Lord, and Kellen's sad death is why there is a Not One More Life, why there is a Black people like me. So it's incredible. It's kind of heavy, but I gotta share something about Kellen. Kellen would be struggling to breathe. I and a bunch of people working on it. And through struggles of breath, he'd say, Dr. Graham, don't worry, I'm gonna be all right. And he was every time until he wasn't. Kellen would come into the ICU, literally on death's door. The minute he got his voice, he said, now you promised me I'm gonna get a hamburger. You know what? 2 o'clock in the morning, we'd get the boy a hamburger. Kellen, also the sports thing. That's a very important point because Kellen played little pee-wee football. Okay. And people with asthma need to know that you can be taken to the point where you can participate. And the thing that I died laughing, I tell us, how's it going? Well, Kellen was a stocky little guy and he was on the line. I said, how's it working? He said, Doc, sometimes I don't even have to knock him down. I get on the line, I tell him, I bring the pain. And he told me that it actually made kids cry. And I was so proud of him. The last thing is to tell you, Kellen educated those people in Colorado too, because when I got here, that's where I trained at National Jewish Hospital and Denver Children's Hospital. My mentor called me about, maybe 3-4 months after I got here. And he says, do you know Kellen Bolden? And I said, no, sir. And he said, well, you need to. And Kellen Bolden, more than any patient I had, informed my care about asthma. And there's really nothing more that I can say that Edwin hasn't said. Thank God for you, Edwin. Thank you, God, for the love of your family. And thank you for sharing your experience.
Absolutely.
And thank you for the honor of taking care of your son.
Yeah, I echo that, Dr. Graham. Edwin, again, our hearts go out to you and your family. We know that you miss Kellen every day, but please know that we are carrying his life and his legacy forward. And with that, I do want to ask Dr. Carter to join the panel conversation and maybe pose one question in regard to research to the panelists before we turn to the questions that have come in from our participants. Dr. Carter?
Yes, thanks. Great job, Dr. Graham. And it's always best to hear from the folks who are living the experience. As I was listening, as a health researcher, what stood out in my mind is this funding comes from PCORI, and there's comparative effectiveness research. The research sets the protocols for what's done for care. So it's very important. And to the 919 folks, 20 people that are on, if you are living with asthma, if your children are living with asthma, and we know there's intergenerational, we as researchers keep hearing there is not enough engagement from people of color in research. And I really want folks to know how important that is. And that's why I said you have the knowledge. And with all the COVID-19 outcomes and the disparities and the burden of morbidity and issues that we're having and the deaths, it is very important that people of color engage in research. So to all of our panelists, I would ask you, have you all participated in research as part of a focus group or interview? But where I come from, I like a model where the patient is part of the investigative team of setting the agenda. So we really want people, end users, and particularly patients of color, to engage in research, because so many decisions are made from these studies that impact your care. So to the panel, have any of you all engaged as part of research projects?
I've been in a focus group. I was in the core asthma group, and I've been in several other ones. And it's been really empowering for me to actually meet other people that have, the same asthma type of problems as myself, or experiencing different things. And also I've been able to learn from them and get more research done for my own asthma through the experience through the focus groups.
Excellent. And also with PCORI, they look for patients as ambassadors, and they do genuinely engage people in research. Edwin and Aisha, what about you all?
Well, I'm trying to get a little bit more involved in Dr. Graham, Not One More program.
Okay.
That's a great program. It's like a preventative program. What can we do in the community to be aware of asthma and what it does and how to control it, how to get help, even just sitting down talking to someone. I think that's something that I think I'm going to pretty much more get involved with, Dr. Graham. It's a great program.
Aisha?
And for myself, I've actually also been a part of an asthma focus group. I've also been involved in clinical research trials for asthma medications. I have not been a patient, but I've also been involved in Dr. Graham's group, as well as Not One More Life, screening asthma patients for future studies. So I just think it's imperative that we're involved and that our voices are heard. And the more you know, then the better you can do and spread the word going forward.
And I would encourage to Tanya and Mary, you have a really broad set of participants on. It might be helpful to let people know the pathways and the entry points to look at research, because I do know with all of the health inequities coming out, researchers are looking for patients to engage. So Tanya, I'll turn it back over to you.
Absolutely, Dr. Carter. We have so many opportunities that are coming every day to the network for patients to be engaged in research. And we actually, on a weekly basis, send out those opportunities. If you have given us your email, we can follow up with research opportunities for you to get engaged. And then we also will tailor our final session on that very topic, how to get more involved in research after the Black People Like Me virtual conference series. So we do have time for one more poll question and then some of your questions and answers. I'm going to go ahead and launch this poll, our fourth and final poll of the day. It says, does hearing from patients like you who have shared their real world health issues and struggles help you to gain a better idea the questions you should ask or that you need answered in order to make better healthcare decisions for yourself? Yes, somewhat, or no. So we'll give everyone just a moment to log the responses. Again, I cannot say enough the powerful stories that have been shared today. This has been, I think, one of the best sessions yet. So incredibly informative, but also inspirational. And we really appreciate everyone's insights. So we'll go ahead and give just another moment for everybody to log in their response. Looks like we still have well over 900 people on the line this afternoon. Thank you all so much for sticking with us. We're going to get to just a few of your questions after this poll. So let's go ahead and end the poll and share the results. Overwhelmingly, 89% say yes and 11% say somewhat. For, again, reading the stories of patients like you and of understanding, again, some of the different struggles that they have encountered and that I know some of you have encountered on the line. So at this time, let's go to the Q&A portion of our time together. The first question actually goes to Shernette, and it is, does bronchial thermoplasty hurt?
No, it didn't hurt. It felt like a little, you know, like kids toss it about and you punch yourself and they punch themselves in the side type of thing. It felt like that after the surgery and coming home. But then the day after that, that's when you start to feel not great, to be honest with you. That's when you need to take a bunch of breathing treatments because basically you irritated the lungs, so now you need to unirritate the lung.
And about how long did it take you to recover from bronchial?
For me, it was depending on where the area was. Since it's a 3-part surgery, the first part, which is in the right lower lobe, only took about 2 weeks. Then the second one, since I become so, it took about 4 weeks, which is in the left lower lobe. And then the apical lobes, which is at the top, it was just like maybe about 2.5 weeks.
Okay, great. So the next question comes from Bill, who asked, how can we be sure that the COVID-19 vaccines don't have long-term side effects? So maybe Dr. Graham, if you'll take this one first.
Okay, well, first off, these studies that have brought these vaccines to light had by definition through the NIH to have representation inadequate numbers by people of color. And I actually know 3 people that were in trials. So one with Moderna and 2 with Pfizer. So these have been adequately demonstrated to be effective in African Americans. The safety claims that they go do reflect. And that's a very important question, because early on, Blacks were not included in a lot of medical research. So a lot of times those findings really were not vetted by our participation. But I think people should be very secure. My wife and I are both, retired from clinical practice. We're now about 6 weeks from our Moderna 2, and we're getting close to having a normal life, and we're surrounded. I don't want to be political. We're in a kind of a conservative area where people don't wear masks. We still wear masks.
Yeah. And so the follow-up question is around allergic reactions to COVID-19 vaccines. What have you seen? What's the likelihood of an allergic reaction to COVID-19?
The data that I've read suggests that they're very minimal. And none of them, to my understanding, and I do read the literature fairly well, have resulted in any deaths, okay? There are some local reactions, not so much to the virus, but the constituents that go into its preparation. But we're talking less than 1 or 2%, and none of these, to my knowledge, have been life-threatening or resulted in death. Anytime you take something into your body for the first time, you should be aware and you should be thinking about things. And with a vaccine or any treatment, you should certainly report any concerns you have to your physician. But these vaccines have proven to be very efficacious and very effective and very safe. And one of the things that really hurts me to the quick is I read the data at least once or twice a week. And there's an old saying, and I don't mean to offend any people, but a comedian once said, when white people get a cold, Black people get pneumonia. And that's exactly what COVID's been. The impact on African Americans in terms of sickness, hospitalizations, and death has been staggering and disproportionate to our percentage. So we as Black people must read everything we can. We must get comfortable with this vaccine. We have been mistreated by the medical establishment in the past, but this is literally a once in a generation crisis. And every Black person that I hear and hear you needs to get the vaccine, because we are suffering and dying disproportionately due to this disease.
Absolutely. Thank you, Dr. Graham. So the next question actually goes to Aisha. Aisha, tell us what an asthma action plan is and how it's worked in your asthma journey.
Sure. So asthma action plans are imperative. I mean, it actually will buy you time. I mean, when you're learning about your asthma action plan, you know what your triggers are, you know what ranges you are, when you take your medications, and how to life daily with living with asthma. I think they're imperative. Like I said, you know when things are going on and when you need to intervene, and it'll actually buy you some time. And you can also then report, you get more involved. Having in pediatrics, you have your kids more involved and more interactive in their care, and they can follow. They have these fun pediatric asthma action plans where you can follow and start to get them to learn about how they need to take their medications, when they need to take their medications, are they taking them appropriately? And then that carries on into their adult life. I mean, while it's cumbersome, we have to start learning and changing their ways of thinking and intervening a lot sooner. But knowing where you are in your asthma every day, daily, will help you understand more of what's going on, and also to live a better, more fulfilling life where asthma is not a hindrance to you, as it was for me, because we didn't know any better. But getting that asthma action plan established is imperative to someone living with asthma, I think.
Yeah. So just kind of a written document that tells you what your triggers are, how to control them, how to take your medicine, when to maybe step up your medicine, and then most importantly, when you may need to seek emergency medical care, right? If your symptoms are uncontrolled. So perfect. Thank you so much for sharing that. The next question I'm going to ask Edwin to weigh in on. Edwin, you yourself have asthma, and your son had asthma. Is there a genetic component to asthma? Because we also heard about the environmental component of Helen's exposure to fumes and exhaust at school. But is there that genetic component of families?
Yeah, yes, it is. It's funny that you say that, because I was going to mention that earlier when I was speaking. Actually, my grandfather had it, and my uncle had it, and I have it, and Kellen had it. So to answer that question, yes, it's family origin. It comes down through the family. And from my understanding from my grandfather and my uncle, they had it pretty bad.
Yeah.
My uncle had it real bad.
Yeah.
So
Yeah,
to answer that question,
it does run in families. It runs in my family as well, and many others on the line. So there definitely is that genetic component and also the environmental component. Now, the follow-up question to that is, do Black people suffer more from environmental allergies? Dr. Graham, can you share any thoughts around that?
Yes, there is evidence that Black people do suffer more from environmental triggers and environmental allergies. Part again about this country are disparities, and African Americans are more likely to live in substandard housing where they're confronted with poor ventilation, maybe infestation with roaches, living near a central traffic corridor. You know, in our urban centers, a lot of people of color live in the inner city, so they're exposed to all the exhaust that comes. You know, Atlanta has 3 different interstates crisscrossing it, and Black people are concentrated in those traffic corridors. When you're exposed to things like that, you're much more sensitive and you're much more likely to become allergic. And then with the things that you're not allergic to in terms of pollutants, you have an extra dose as opposed to people that live farther away from those sources. The other thing is Atlanta used to be closest to the Bowen electricity generating post, which was one of the most polluting in America, and it's since been closed. So, you know, these are the things that people of color, in particular, people who are poor in general, are often exposed to things that both are harmful and may sensitize them and develop allergies.
Thank you so much, Dr. Graham. So we have time for just one more question, and then a couple of closing comments. The final question is the COVID vaccine effective? And again, you may want to talk about all different types of the COVID vaccine, because there are now 3 approved different COVID vaccines. So Dr. Graham, I'll let you answer first.
Okay, they are all effective. They are all in the range of 80 to 90% in terms of effective in preventing the disease. More importantly, they are all over 90 to 95% in terms of preventing death or serious infection. So no vaccine ever created is 100%. These vaccines are very good, okay? And I think that if you were asking me as a betting person, do I want to have 0 or 80 to 90%? I'm going with I'm going with 80 to 90%.
Absolutely. And again, it is important to note that all of the vaccines were very effective at ensuring no hospitalization and keeping people from dying. And that ultimately is what we need to begin to continue to move beyond the pandemic. Now, we did not hear from any of our patients today about if you had experienced COVID or long haul symptoms, but there are a lot of questions around long haul and the concern of the asthma community with COVID. Long haul is having symptoms well after you have recovered from that infection period of a week or 2 weeks after COVID. So one of the things that was asked is, are we doing anything around long haul recovery, a support group and a connection? The network we are working on developing the plan to support the long haul COVID community long term. But Dr. Graham, any closing remarks about COVID?
No, I actually have a friend that is in the midst of this, and respecting his privacy, he's on the line. The long hauler syndrome is a continued inflammatory response the body has to the infection, some of the consequences of what the infection has done. But like my friend, people are recovering from that. There's still research going on to see why some people get it. And I got to be honest with you, I'm not informed in what that research has, but it does happen in a significant number of people, and it can be frustrating and debilitating. But just as the friend who remains anonymous, he is improving, and most people with long haulers do get through it. But it really stinks because you've gone through a life-threatening infection and you got to deal with a slow recovery, but recover you will.
Absolutely. And, I think one of the key things here, though, and it's alluded to in this question, is don't allow anyone, your healthcare provider, your spouse, or anyone else, to discount how you're feeling and to dismiss your symptoms in the long term. Again, the data is coming fast and furious that long haul is a real thing. And in fact, again, many patients continue to suffer for quite some time. So thank you. Again, I want to just thank all of our panelists. This has been fantastic. You all have really hit it out of the park today. And I also want to remind you all that as we continue your journey, we want you to stay connected through our Facebook page, the hashtag Black People Like Me Facebook page. Continue to post drawings, photos, quotes, any type of inspiration. This is an opportunity for us to celebrate our progress and also to connect with our community. And then I want to remind you all that we do have one final session in our Black People Like Me video conference series. It will be held on May 13th at 5 p.m. Eastern. We will have a registration that is ongoing for that and forthcoming in the next few days. Please don't forget, we've got our Asthma 360 registry that you can join today for research opportunities. We also have a COVID-19 registry. Allergy and Asthma Network is committed to providing you with culturally sensitive, tailored education materials. So always visit allergyasthmanetwork.org to learn more about how to get more involved at the network or become a PCORI research patient advisor. Again, I want to express my sincere gratitude to our Director of Research, Mary Hart, to our Chief Digital Officer, Linda Mitchell, for organizing today's event, for each of you for participating. It truly has been fantastic. Dr. Carter, Dr. Graham, as always, thank you. And again, most importantly, to our patients, thank you for sharing, for your courage of being here and helping others to breathe better together. We wish you all the best. Have a great evening, and we'll talk soon. Take care.